Hi everyone, this is Troy Tacey from Fordham University, and this is part 6 of my series of videos to help increase understanding of the current coronavirus outbreak around the world, and particularly in the United States, where I live in near New York City. So if you haven't seen the previous videos, this is the sixth of the videos that I've done, and if you Google my name and go to my Google Sites page in the COVID-19 tab, you can get a link to the YouTube videos 1 through 5, as well as some other things that I've written on the coronavirus outbreak. So as I said, this is part 6, and what we're going to do here is just take a quick look at the data in the US. So if you've been following along with these videos, in the last video I took a look at Italy and asked if they were successfully flattening their curve, and the answer was yes. Even though we saw some pretty large increases in cases, we were able to just look at data in the right way and understand what was going on a little bit better, and understand that they were actually slowing the growth rate of cases just by using some data that's easily available on the web. And what I'm going to do today is do essentially the same thing, except I'm going to perform the analysis in the US. First, we're going to take a micro level view at New York City, and then we'll broaden the picture out to all of the US. So what we have here are the cases in New York City. And you can see that there have been what look like some pretty dramatic increases. They are pretty dramatic increases. And as of April 2nd, we have just under 50,000 cases in New York City. Now, what I want us to do, though, is unpack this a little bit, and I want to describe why looking at the data in the way that's presented on the screen right now isn't exactly the best way to do it. So if I jump over to worldometers.info, they've got a great website that collects data on the coronavirus cases and deaths and lots of statistics about lots of things throughout the world. So if we look at Italy, remember the thing that we said was that you don't want to look at data on a linear scale, you want to use a logarithmic scale. And if you are early in an epidemic, then what you would expect to see is this data should fall pretty nicely on a line. But with Italy, what we see is that the data has curved quite a bit. And as this data curves, what that means is that the growth rate of the epidemic is slowing. It's getting smaller and smaller. So we don't want to look at the data on this linear scale. We want to look at it on a logarithmic scale, because we can then infer things about the growth rate of the epidemic just from looking at that one graph. So we're going to do that with New York City. And if we go to the next graph, we have the same data as we have right here. It's just plotted on a logarithmic scale instead. And what you can see is that early in the epidemic, the data fit really nicely on this red line. So if you look at the data from about March 4th up until March 16th or so, the data on a log scale was very linear. And if we continue that trend, we would have followed this red line, which you see sort of moving up through this graph. But what happened, luckily, because of the social distancing measures that we put in place, is that this curve got much flatter. So the slope of this red line was about 0.4, and the slope of this blue line, which is the current trend of the last week's worth of data, is just a little bit over 0.1. So the curve, the slope of the curve today is about 1/4 what it was in early March. And this gap between the red line and the current data, that's essentially a measure of the effect of social distancing. So we can take those differences between the red line and the actual data and how it played out in the world, and look at the effect of social distancing in terms of the number of cases presented. Number of cases prevented. So if we would have stayed on that red line, the trend line from early March, we would have well over 200,000 cases by the end of March. We didn't have anywhere near that number. We had about a little bit less than 1/4 of that, between 1/4 and 1/5 of that. And that difference between 200,000 and the 40-some thousand cases that we had at the end of March, that's the effect that social distancing had to slow down this epidemic. So we prevented probably well over 150,000 cases of the coronavirus epidemic in New York City just in the last couple weeks here. So these social distancing measures have really helped. So the growth rate, it continues to drop, but if we kind of take a worst case scenario from this point moving forward over the next week or so, if we stay on the trend of this blue line, we would expect by April 10th to have about 121,000 cases. So we would expect the cases to go up by a little bit under two and a half times between now and April 10th, about a week from now. Now, hopefully, if we're able to flatten the curve even more, then we'll have less than 120,000 cases, and again, that's a measure of the effect of social distancing. So if we have anything less than, say, 120,000 cases in New York by April 10th, then we've seen even more effects of social distancing kick in between now and then. Now, if we go to the US and look at the country overall, the trend isn't quite as good. So let me pull up the US data. So again, we see the typical sort of what looks like a very fast run up in cases. And if we, oops, I'm sorry, that's active cases. So if we go to the total cases, the cumulative cases, we see this very fast run up in the number of cases. Again, we don't want to look on this scale, we want to plot it on the logarithmic scale. And the trouble here is that with New York, we saw a very clear bending of that curve, where the curve is getting flatter. It's not clear that that's happening here in the US yet. This data still follows pretty closely on a line. The only thing is that these last few days, 4, 5, 6 days maybe, we're starting to see a little bit of a decrease in the slope of this line. So if we fit this data back here, it would be just a little bit steeper than this is back here. Now, because this is on a log scale, those slight changes actually have a pretty big effect. But the point is that we aren't seeing a great change in the US in the same way that we're seeing a pretty good change in New York with this curve getting flatter. And if instead of looking at the cases, of course the cases are determined not only by the actual number of cases, but also by the testing rates. We can sometimes get a better view by looking at the number of deaths, because again, that isn't affected by the case rates, by the testing rates. And again, we see that this is still falling pretty much on a line. And the bad news here is that it actually looks like this has accelerated, right? So if we take the middle of March, the slope of the curve is actually steeper than it is from the beginning of March to the middle. So the US death curve on the logarithmic scale has actually gotten steeper, which tells us that the rate of growth of deaths in coronavirus in the US is actually getting worse. So what I want to talk about for a minute or two is why do the trends overall in the US look different than New York City looks? So the big reason is simply that New York is further along in the epidemic and in the social distancing measures that they put in place. So we're getting a slower growth rate in New York City, we're getting a slowing of the growth rate in other places that had the epidemic visit them first, but this is being offset because the epidemic is being spread to more and more places across the country. And if these cities and towns that are newly being invaded by this epidemic don't act quickly, hopefully before the epidemic even arrives, then they're going to see explosive rates like New York City did early on, and those explosive rates in those towns are going to offset the gains of social distancing in places like New York City and other places where the epidemic has been for a while. And we're going to see this trend continue that we have. We aren't going to see the overall curve in the US flatten because other cities essentially aren't acting quickly enough. And again, you can see that it's not just an artifact of testing numbers, but we're seeing that the deaths when we plot them on a log scale are still fitting that almost perfect line. And that's telling us that essentially the gains in New York City aren't being extended to other areas of the country. So hopefully other places around the country will tighten up their social distancing measures. Hopefully New York City will continue to be vigilant, will tighten perhaps even further their social distancing measures so that we can really clamp down on this and get that curve to start bending on the logarithmic scale. So that's our hope. So what I'll be talking about in the next video is essentially what will the peak of the epidemic look like, and why just reaching the peak isn't going to indicate that we're at the end of the epidemic. So we want to talk about when we hit that peak, what happens next. And what we'll see is that the epidemic isn't immediately going to disappear, but we'll have a similar period of time after the peak of the epidemic as we had before the epidemic. So you can almost think about the peak of the epidemic as being a mirror, and what we had as a run-up on the left-hand side of the mirror is going to look very similar to what we have going down the other side of the mirror after the peak of the epidemic. So even if we are able to hit the peak in the next 2 or 3 weeks, as everyone hopes, we've still got quite a ways to go, and that will be the topic of the next video that I'll put up. So I hope everyone does their best to stay well, and I will see you soon.